Hello! Today, I will discuss everything you need to know about septic shock and nursing treatment. Let's begin with some basic definitions to differentiate infection, sepsis, and septic shock. After that, we will move on to symptoms, pathophysiology, treatment, and nursing interventions. Infection is the first step in septic shock. Infection occurs when harmful microorganisms like bacteria, viruses, fungi, or parasites invade the body and multiply, causing damage to tissues and organs. Symptoms vary depending on the type of infection, but often include fever, pain, swelling, and redness. Next is sepsis. Sepsis is the body's extreme response to an infection. It is a life-threatening medical emergency that arises when the body's response to an infection injures its own tissues and organs. Symptoms of sepsis may include a high heart rate, fever, confusion, shortness of breath, and extreme pain or discomfort. Shockingly, 1 in 3 hospital deaths involve sepsis, making early detection by nurses crucial. If not treated early, sepsis can evolve into septic shock, a severe and life-threatening condition. Septic shock. Septic shock is a severe and critical condition that occurs as a complication of sepsis. In summary, it causes vasodilation, leading to decreased blood pressure. With poor blood flow, tissues and organs do not get the oxygen they need, leading to severe organ dysfunction and failure. Now that we have a basic knowledge of the cascade that leads to septic shock, let's dive a little deeper. It's important to remember that septic shock involves significant vasodilation and increased capillary permeability, not low cardiac output as in other shocks. Risk factors include suppressed immune systems, extreme ages, recent surgeries, chronic diseases, and having indwelling medical devices. Early signs of septic shock include warm, flushed skin and high cardiac output, progressing to cold, clammy skin and low output. Symptoms of septic shock include those of sepsis, plus dangerously low blood pressure that does not improve with fluid replacement. Now let's review a detailed pathophysiology to get a better understanding of why these symptoms are occurring. These topics include inflammation, nitric oxide, and a hypermetabolic state. Septic shock involves a widespread inflammatory response triggered by an infection. Bacterial toxins activate immune cells and endothelial cells. These cells release pro-inflammatory mediators. One of the key players in this inflammatory process is nitric oxide. Normally, nitric oxide helps regulate vascular tone by relaxing the smooth muscles in blood vessels, which is essential for controlling blood pressure. However, in sepsis, the production of nitric oxide is significantly increased. In septic shock, the body's response to infection is significantly amplified, leading to a hypermetabolic state. This state is characterized by increased energy requirements, fever, increased protein requirements, tachycardia, and tachypnea. The hypermetabolic state also involves protein catabolism, leading to possible metabolic acidosis and respiratory acidosis. If you are unfamiliar with acidosis and alkalosis, please check out my video on fluid and electrolyte balance. Now that you understand the pathophysiology and symptoms of septic shock, let's discuss the most common assessment and diagnostic tools that you will need to know. The tools I will cover today will be MAP calculations and serum lactic acid. When assessing for septic shock, medical professionals will calculate mean arterial pressure, MAP, which is the average pressure in your arteries during one heartbeat. It's a measure of the force exerted by circulating blood on the walls of the arteries and depends on both the cardiac output, the amount of blood the heart pumps, and the resistance of the blood vessels helps monitor blood flow to organs. A MAP below 65 mmHg indicates poor perfusion. Our next tool is checking serum lactate levels. High lactate levels in sepsis patients are often a sign of severe illness. When there is not enough oxygen available for cells to produce energy, a condition known as hypoxia, they switch from their normal, efficient way of generating energy, which requires oxygen, aerobic metabolism, to a less efficient method that doesn't require oxygen, anaerobic metabolism. This switch results in the production of lactate, a byproduct of anaerobic metabolism. Therefore, high serum lactate can indicate that the body's response to the infection is causing harm to its own tissues and organs, leading to poor perfusion and oxygenation. Monitoring lactate levels can help healthcare providers assess how well a patient with sepsis is responding to treatment. A decrease in lactate levels over time is generally a good sign and is associated with better outcomes. Almost done! Let's review nursing interventions. It's important that the nurse continuously monitors vital signs, including heart rate, blood pressure, respiratory rate, and temperature. Frequent assessments help detect any changes promptly. It's crucial that nurses ensure oxygen is maintained. This can be done by administering oxygen through nasal prongs or ventilation. Nurses should also assess fluid status, urine output, and signs of hypoperfusion, such as cool extremities and altered level of consciousness. Nurses must assess nutritional status and initiate enteral or parenteral nutrition as needed. Treatment strategies include rapid antibiotic administration, fluid replacement, vasopressor use, and potentially mechanical ventilation. Thanks for watching. Please like this video if you found it helpful and subscribe to my channel for more nursing videos like this one.